All right, well, good morning. I think the best thing about presenting here is we look around the room. UVA HealthSouth, we're the only acute rehabilitation hospital in Charlottesville. We're really proud of our designation there. But the comments today are so apropos because we get to do what we do and be who we are because of so many of the collaborations that actually occur in this room. We actually started a multimedia campaign a few years ago, and Sean was not my original sales person, Link, but he's come on board. And so if you anybody, yeah, it was big shoes to fill, I'm just going to say. But if anybody watched the Super Bowl, you might have seen some of our commercials on, thanks to Sean and his team. Christine Shaw has just been a huge supporter and very influential, coming and helping us out in September when we do our community event and different things. So, you know, as we kind of look around the room, it's just great to see so many people. And I think that we all agree that the relationships that are built here really do hold us in good stead as we do what we do out in the community. So as I said, UVA HealthSouth, we're a joint venture between the University of Virginia Medical Center and HealthSouth Corporation. We're the largest rehabilitation provider in the country with over 101 hospitals. We are a hospital, not a skilled setting or a nursing home, so there is a difference in the level of care there. We're Joint Commission accredited, just like any other hospital, and we're also Joint Commission Stroke Center of Excellence as well, which is a separate designation that we've received. I'm not really going to talk about all the services that we do because most of the people in this room, with the exception of the jewelry lady and the limousine guy, which please note as everyone got introduced, those were the two folks everyone oohed and awed over. So I'm not going to spend a lot of time talking specifically about the work that we do, but about the partnerships that we've built and how we've tried to integrate ourselves into the community and what opportunities there are for folks like you to maybe join with us and us to join with you at certain times. Okay. So we are very involved in the community and getting more involved all the time. One of the things we do, we're the welcome sponsor for the Healthy Living Expo, sponsored by the Newsplex. This year's going to be the second annual presentation for that. We guesstimated that we probably saw about 1,200 people come through that venue last year. So it was held down at the Main Street Arena, the old ice rink down there. And I'm sure other people participated in that last year. I'm sure, yes, there should be. It's a great venue. Please see Sean if you want to hear about that. He can give you some connections there. So that's a really good event. And then we're also the proud provider of the Fireworks for Patriotism in the Park, which folks are familiar with that. That's a big event, and we enjoy providing that for the community. The other thing we do, we have an actual week celebration of rehabilitation. It celebrates not only our patients, but the therapists, the nurses, the families, everyone who supports the work that we do throughout the year. We're just the stepping stone. People leave the hospital, they come to us. We're just a brief stepping stone on the path to recovery. So there are lots of people to be celebrated, and we do an annual event. It's a free community event. Free food, free activities, we have live music, we have a classic car show, we do a blood drive, there are lots of things going on, and it's all for free to kind of celebrate. It's in September, whatever week there's not a home game, because they use our parking lot for tailgating when there's a home game for UVA, so whenever there's not a home game. So save the date, think about that. It's called the Road to Recovery Tour, and we hope to see you guys there in September. And if it's something that you think you'd like to be a vendor and be there to meet and greet folks from the community, we have little kids because we have a moon bounce all the way up to the grandparents, you know, please reach out to us. We'd be happy to have you involved. Now, as to actually the work that we do, we have both inpatient and outpatient care. Inpatient, we deal with a lot of the patients that you all see after they leave here, stroke, spinal cords, cardiac, pulmonary, lots of patients like that. In our outpatient setting, we do all of that, PT, OT. We also have hand services and sports medicine. We do a lot of cutting-edge research on the outpatient side with UVA. We have a therapy residency program as well that's really specialized and something that we're very proud of. We're very involved with the MS clinic. We, looking to see here what else we have going on that we specifically talked about. So in a lot of specialization with the neuro, amputee, TBI, spinal cord, folks that you would anticipate seeing. We're involved with Continuum Home Health Services, which is actually a UVA entity, but we provide staff to that entity, and so we're involved in that as well. We have the big and loud specially trained therapists for Parkinson's folks. For those in the room who may not know what that is, it focuses on these patients maintaining their movement. If you know someone with Parkinson's, you know that sometimes their movement becomes very limited. Their phonation and their voice can become very quiet. They sort of bring in, and all of this specialty training is about making the movements bigger, opening up that phonation so that they maintain their ability to socialize and communicate and express their needs. So we're really proud of that program. We also have multiple support groups that work with us. The Stroke Comeback Club is a very active, they are a very active club. Despite their name, you would think that they might not be, but they're an incredibly active group, not only on site at the hospital, but they do a lot of community activities as well. And they're always going on little trips places and doing different things. So they're a very big group. The aphasia group, for folks who are having difficulty with communication and phonation, again, there's a support group for that. Then we have a community-driven traumatic brain injury group. This was actually started by one of the moms of a patient. And so she utilizes our space, and we support her, and however that group needs to be supported. And that's a community group as well. So we're real proud to have those on board. And there's just some information. If anybody has it, we have some cards. We hope you never need us, but if you do, we're there.